Question is how we can give them better interface than a typing interface for entering the data. And fortunately today with the technology, there are multiple other interfaces are available which could be used very easily while the data input to the computer system is concerned. Maybe it's a voice interface. Now today, most of the time, whatever we are telling, even a simple Google Talk, they are able to understand and convert that into a text. And sometime I found out the uses as well as the accuracy percentage is quite high. The other way also of looking at it, that is it possible that I write something and then gets converted into a text into the computer where I can do some analysis. It's not about just writing something and then that gets scanned copy which we may not be used. And these are the technology which is readily available and they're being used by the other industry. We need to embrace this technology along with the other technology. And then we can think about using these emerging technologies of AI, IoT, and blockchain. If we are not having the required sets of data, then probably these technologies may not work. What it can do for the healthcare. So if you can please tell us how this technology works, what is this technology behind it, and can share some lights about whether you think or you have seen that this is really working for healthcare customers.
Okay. So fundamentally there are 2-3 characteristics. So whenever you think about blockchain, think about immutability. That means some information stored in the ledger or the construct of blockchain that is very difficult to change. You cannot change. So that is one aspect of characteristics of the blockchain. Second is a set of use cases, not only in healthcare, in supply chain business, you will see that is around the track and trace. So traceability, visibility, supply chain visibility, that is another very interesting domain where blockchain can support using the technical thing, because blockchain is more like all partners joining an ecosystem with a common cryptographic storage point and shared data. So in this way, in the supply chain domain also, later on we will discuss about that, you can share the information in the ledger that can be instantly seen with other participants. So you can net think of a blockchain is a network of business participants. Centrally there lies a ledger. That ledger is nothing but a data store that you cannot change, immutable. And through this immutability you can store something that will be existing there eventually. And also you can share the data through this process who are joining in the network. So these are the 3-4 characteristics: immutability, finality, track and trace, provenance.
Discuss more on the uses and the use cases for the blockchain in the healthcare. Share some examples of innovations that you have seen in practice, where you have seen that people do plan and then finally it got implemented and they have seen the success of it.
So I think one of the important factors about when technology enables any of the transformation or any marquee initiatives today is about inbuilt flexibility in your design, in your processes, in your technology to adopt anything that comes out as a challenge that you probably need to address. So that is one of the areas. For example, if I have to specifically pick up one case, like let's go with the Ayushman Bharat only. It gives states, health is a state subject. So though center is driving it, it gives you enough flexibility to choose your model of implementation, to expand beyond the basics that are given to you, in terms of, what all packages do you want to offer, expand beyond what the center is saying that, how do you want to implement, whom do you want to implement it for. And various states and union territories have come up with different kind of models of implementation, different kind of inclusion models. All of that has been supported by a common IT platform. So I think that's where the inbuilt innovation was there, and there is a lot of work which is now happening now that there is uptake in consumption of healthcare under a health insurance.
Separate IoT called IoT, and why regular IoT working for other industry will not work for healthcare. If you can throw some light on that.
IoT, MIoT, HIoT, essentially it's the new kid in the block. And 2016 onwards, the concept of IoT, which is in full form Internet of Things, that means the smart things, that has grown at a CAGR of like 38%. And only at healthcare, Gartner is predicting is about 160 billion of usage, and it will grow rapidly. It's all about is that different devices, and not only devices, it can be human beings or any, for that matter, any live being, like a farm also, can have a definitive address or identifier, which is called the unique identifier. It has to have a unique identifier, and through that unique identifier, it would be able to send out discrete data into a network so that the data can be consumed. That is the fundamental concept of IoT. There are a lot of variations, a lot of jargons. I'm not going into that complexity. I'm just trying to be at a very high level, 40,000 feet layman's kind of a language. Now, that said, when it comes to healthcare, healthcare has three definitive use cases where this application of IoT is being very much used. You see my smartwatch, this monitor trackable devices, your smartphone. All those things can capture a lot of data, and those data can be accumulated through different other devices or through some network, etc. Those things, that is one part. The second part, which is really, really picking up, especially in the US, is the home health monitoring and the elderly monitoring, the monitoring part of it. Because they try to do so, and IoT can really help some preventive actions in the healthcare. You are having a symptom of a stroke, or you are having a symptom of a mental illness, which is another very upcoming area, which in the traditional area is treated post facto, which is possibly very late. So IoT or those devices which is monitoring your vitals or some other parameters and send it to the doctor, even as a form of a warning, can make it a very helpful thing for the care provider. The third area which is taking up in healthcare is the operational management part in the hospital. You can track your assets, as well as you can, there are concepts of like smart bed also, which is coming up in the US. Smart pill box, which will tell you whether you have consumed your medicine or not. Those are the different discrete areas, but it needs to be channelized. And we have to note one thing, because IoT means connection of lots of devices. It generates a huge lot of data.
And if you can tell us about how AI is today impacting our life. Is it coming? Is that come? It will come. And if it has come, then really are we using this as a doctor? What kind of AI you yourself use rather than only promoting?
I don't think anybody here can raise up their hands and say, no, I have not used any AI so far. So machine learning AI is there in everybody's life. We can't deny it. And healthcare, unfortunately, it is not so well been taken up well. There's a lot of sensitivity from the doctor side and from the hospital side that AI might take up some of the jobs with them, something like that. I have a beautiful example here on own myself, what I was able to do, and I'll put it on with just like as much as possible, like less than 2 minutes. In my previous company is the TechMed Laboratory. It's a laboratory company. We have done a PPP project, public-private project with the Orissa government. Orissa has tendered out the 32 government hospital, district government hospital laboratories to us. District government hospital laboratories to us. It is a big project we wanted to do. I said like, okay, let's go forward and take the project. Then Orissa government gave us a catch. They said like, you have to do in the respective turnaround time or else we will not pay you the money. I said turnaround time is not a big issue, let's take up the turnaround time. Then came the real trump card here. They said, you have to do a blood smear in 4 hours. A blood smear in 4 hours. So to give you a little background, in order to do a blood smear, you have to keep the slide in the microscope. A doctor has to see it by himself and manually write a report and give it. And if I have to do this in 4 hours, then I at least need 32 doctors in 32 different locations. It might look impossible, probably the cost is too high. Even if I want to pay for 32 doctors, I'm not going to get 32 doctors in deep inside Orissa. I said, like, let's scrap the project now. So this technology is called a computer vision technology, a sub-branch of an AI. So why don't we use this technology in here? So what we started doing is, I had a huge amount of data being in healthcare, in laboratory. I started training all the RBCs, WBCs, blast cells, memory cells, malarial cells. So once you start putting all the data into this particular program and suddenly give a new slide to it, it can identify the cells there. It can give in percentage, okay, 96%, 92%, 93%. But here what we have done is, we have not made this technology to take a decision. It will be given to the doctors to decide if it is 92%, you go for it. Is anemic or not? It's up to you. We don't decide whether it's anemia or not. It's not an anemia. So now, with just 4 doctors in 4 different locations of Orissa, just 4 doctors, we can implement this technology. Technology is almost ready. It has been waiting to be getting the ethical clearance from Ramachandra Medical College. We're waiting for it. It can do. So what I'm trying to say here is, when this technology has gone so deep inside Orissa, and just with 4 doctors, we can able to give a pathological opinion to so many people over there. Why not it can do with other specialties as well?
The role of data and the training of the various model that we have heard, that how easy or difficult to get access to the data, and how easy or difficult now you are facing in your new role to see that when you are trying to train any model, and whether you are able to get the data easily available from the market.
It's the most complex question for the entire AI. If you solve this particular problem of data, you can solve the entire AI solutions and then the requirements. In India, in healthcare in India, unfortunately, we are very, very poor infrastructure. I hope everybody in this panel and the audience can agree to this particular component on it. But with whatever data you currently have, okay, we can start with that particular component. Example, I can tell you, we have a product which says on diet. Okay, so there are small amount of diet data which we had. We created a diet model. In the diet model, the data has been trained to the particular machine learning, and you can give the. Now the software is going to give you a percentage of 64% accuracy. But the same software put to use for years together, probably it can grow up to 94%. I don't want to discourage saying that always that no, there's no data, so we can't do it. No, there is a way. We can start working on it, start looking into it, structuring it, put it in a process flow. Someday we might reach going forward. This is on the prospective side. On the retrospective side, yes, we are in conversation with government in every way to have a biobank concept, a digital biobank concept. Same has been proposed to Ayushman Bharat and everywhere. So whatever health records you have, in whichever format you have, take those particular digital, take the thing, put it in a bio format. Okay, I take the data of a HbA1c of a patient sitting at home, or patient sitting at a government hospital, or he's doing a small test by himself in a private laboratory. Put all them together, we can able to predict what is his next diabetic medication, or we can predict when the new guy is going to be. Whatever data we have, we can go forward.
They are stored in multiple places. They're not available in one places. What we should do to make sure this data is accessible to every systems? Because if we don't have the data, then either it's a blockchain or even AI. Neither of them would work. We need to give them the data. But now they are all available in silos in various places. What is your suggestion? What we can do with this?
Let me first give a little definition of it. What is that? Integration we all know. Pulling data from one place and getting into a system. But what is interoperability? I would call it as a translator. I do that as my bread and butter. I am the translator. People are talking in different languages, translate that data, or whatever the feed that comes in, be it structured or unstructured. And when I say structured means, I know there is a syntax into that. When I say unstructured, we call it semantic interoperability. So essentially the doctor's note, or even for the machines, but there is no one defined standard that every device is following to send the data out. So how do we gather all those data as well as convert those into a standard homogeneous format, so that, and what the first question is that what the data is good for, unless we do the analytics. And as AI is an artificial intelligent way to analyze the data. Be it AI or be it any other application, be it any kind of predictive analytics or whatever it is, unless we are able to convert all the stream of data that is coming in into a standard format using interoperability techniques, we are not able to process the data meaningfully. To do that, there are certain built-in tools that are available in the market which can do. There are some specific tools for doing some specific work. Address that at the right policy level, we can control that disparity of the data elements that is coming up, and we can make standards. I know that for a healthcare exchange, SNOMED City has been taken as a standard by the government of India. But SNOMED City is not the last thing. There are other areas like in IoT, how the devices would send the data.
A couple of meetings with Government of India where there's a lot of work is being coming up, and government probably is coming up very soon with certain protocol for this data exchange. If you may throw some light on that.
I think, like you rightly pointed out, there is a lot of work which is happening, and what Bhaskar mentioned is the elemental problem for us to solve. The first thing for us to achieve interoperability is to bring in certain registries and standards. So if I talk about registries, in morning we heard that from the person from Apollo who was talking about a universal health identifier. It's basically elemental for us if we are talking about predictive care. Right from my birth till whatever age I am in, if I want to start linking my medical records and build, have that opportunity of creating a longitudinal personal health record, I need to, one, build in certain registries. I need to identify one person in a standard way. The second elemental part of building health records is, I think I put it across in this way, that do not disrupt, transform. So don't change the elemental way healthcare service providers, their job is to provide healthcare services and not technology services. Let them work the way they are working. Bring in standards, bring in protocols like Bhaskar also mentioned. So we have to think through, what is the iterative approach that we take to it. Today, so the other part that, at IRDA and NHA has been working on, and recently, a report has been published around is setting up of a health claims platform. Why are we talking about that? We're talking about that because, we look at somewhere around, 7.5 million claims being processed only under Ayushman Bharat in this year. Parallelly, if you look at, what is the number of claims that are being processed in private sector. Now let's look at, what is the cost involved in processing one claim, and that really happens to be which we believe happens to be one of the biggest reasons that we are still way far behind from looking at including OPD also into, assured care. So that comes out to around 500 rupees per claim. And let's look at, what is the consultation fees that we kind of give to a doctor for getting some OPD consultation. That is one, and one of the most important aspects here is, like, this is healthcare data, and let's leverage onto learnings from global experiences, and especially our experience with Aadhaar. Consent has to be the primary thing that enables for you to give predictive care or, build in any traceability. It has to be driven by consent. Otherwise, two important principles. We heard about, the concerns about data security. If, yes, we want to use it for predictive care, we want to use it for doing analytics, please do it, but build in anonymization and de-identification before you take it to that level.
You told us about the blockchain, but what is your advice to the hospitals? What kind of a blockchain project you want them to implement, and what they have to do? Is it that blockchain technology is so easily available that they can go to any partner and they can immediately get this done? Because when, as a hospital, we talk to some of the vendor partner, we found sometime even getting a demonstration done on blockchain for some projects is really challenging. How you think, what is readiness, where are we, and what is your advice to the provider?
Basically, I'll answer it in two parts. Many a times we have seen blockchain may be the heart of many of the solutions, but when we are going for a digital transformation, blockchain does not work in isolation, because always we start with a customer problem. And that customer problem may be a combination of blockchain, IoT, AI, so all of the things. So one of the example I can give, I think that was discussed. I think many of have heard the concept of cold chain. So one of the key projects that we are thinking and deciding that During the supply chain process, many of the perishable medicines that go in the supply chain cycle that comes in the freezer container. And if there are some anomalies, some problems in the freezer container, today what happens when we receive the medicine, then only we know that something problem happened, we cannot use that, so which is critical for some patient. But if we could think of a blockchain solution which is mixed with IoT, that freezer container has some IoT device that is sensing the temperature, and whenever there is a fluctuation of temperature, it sends and notifies all participants. That's an excellent project. So a lot of innovative things, maybe that is within the hospitals, like intra-blockchain that we call intra-department, which is a rare case obviously, because blockchain is more successful when you take other partners beyond your organization. But there are still instances what we have seen that blockchain can be used efficiently to manage interdependencies between departments within the hospital and information exchange, because of that blockchain implementation, and they can have the responsibility, they have the responsibility to bring their partners on the network, because a blockchain implementation becomes only successful if the network grows, and that network growth can happen to the domain expert with a association with a technology partner.
So what we are looking at is there are certain AI project which has come much near to seeing the success, certain would take more time, and the challenge with most of the AI projects is the data and the training of the data. So that's the challenge. If you so logically, if we can think this and ask the system to think and apply the same logic, it will work. And it's a matter of time when system is coming to that accuracy level that we all aspire to achieve. Imaging, what I think would be the first one to come over there, and we would have radiologists to focus and concentrate on more difficult cases, easier cases will be done by the system. And this is coming, this has come and this is coming. And the other areas, we would use it as a clinical decision support system, not as a clinical decision making system. And let's make this distinction very clear. It will be a decision support system. Clinician would take the decision, and all the technology are going to help the clinicians to become more efficient in the decision making process. With this, I would like to end this panel discussion. Thank you very much.